All right. Well, we're about 2 minutes before the start, everyone. We're just going to give people a few minutes to join. So hang in there a little bit, and we'll kick it off in just a minute. I see we still have people joining. We're going to wait just another minute or so before we start, but welcome to all of you who are here already. All right, I think we're going to go ahead and get started. Thank you all for being here. Just real briefly, I am Gary Harbison. I'm the Executive Director of the Missouri Coalition for Oral Health. We are a 501c3 nonprofit advocacy organization focused on policy and system change. We raise awareness, engage with community members, advocate for policy change and healthcare system improvements, and work together to increase health equity. We are a statewide network of advocates, including many organizations and individuals with a broad interest in community oral health. Our mission is to improve oral health with all Missourians, and our vision is oral health for all Missourians. We want to be sure to thank the Missouri Planning Council for Developmental Disabilities for funding our current work to increase access to care for people with intellectual and developmental disabilities. So with that, I am going to hand it over to Tiffany Grant, and she's going to do some introductions.
Hi guys, how are you? My heart is actually pounding because I'm super excited about the session. I'm so excited to introduce my friend and colleague, Jeanette Diaz, I'm sorry. Jeanette is a keynote speaker, a public health educator, and alternative practice dental hygienist. Jeanette owns and operates a portable dental hygiene practice, which primarily serves older adults and individuals with developmental disabilities. As an empath, Jeanette deeply enjoys connecting with patients and is dedicated to the human side of healthcare. Jeanette's educational background includes dual master's degrees in dental hygiene and public health, and she has conducted and published research on various men who are dental hygienists. Jeanette is a member and past vice president of the California Dental Hygienists Association. Jeanette was awarded the President's Commitment to Diversity Award from the Massachusetts College of Pharmacy and Health Sciences University and was a recipient of the 2021 Sunstar RDH Award of Distinction. Jeanette currently works as a health program specialist for the California Department of Developmental Services and is an adjunct faculty at the MCPHS University Forsyth School of Dental Hygiene's Graduate Studies Program and at Cerritos College. As a lifelong learner, Jeanette is in her final year of completing her doctorate in health science with a focus on global health. I am immensely proud and honored to welcome Jeanette here today.
Thank you, Tiffany. I have been looking forward to this I think it's been over a year ago that we were talking about this. And so I want to say thank you to you, to Gary, to the Missouri Coalition for Oral Health. Thanks, Ashley. It's been, I've been so excited about this. So happy to be here today.
So with that being said, I have watched you for a very long time. We've actually never physically met, but I've been watching you and I know that you're a force. And so what I want to ask first is what inspired you to specialize in oral health care for individuals with intellectual and developmental disabilities and the aging?
Thanks for the question, Tiffany. I think for me, working in private practice for a long time, I realized that some of my patients were starting to get older. They were starting to have a hard time coming in to the office. I was noticing, changes, just the part of the lifespan, right? We start to get older. And I started to think, what's going to happen when these patients are no longer able to come see me? Who's going to take care of them? I also was learning from my patients about family members, friends who were unable to come to the office, those with disabilities, as well as older adults. And so I think that's really where the inspiration came from, is I wanted to be able to continue care to these patients who have been, committed to taking care of their oral health, as well as to reach out to those who I know weren't able to come into the dental office. And so that I would say that's really where the inspiration, came from.
Okay, and I know you've been doing this for a very long time, and this is kind of like what you specialize in. What do you see are the unique challenges with dealing with patients, this certain population, regarding their oral health and access to oral health?
This is a big question, Tiffany. I think some of the challenges that come up are navigating services. When you're working with older adults and people with intellectual developmental disabilities, it can be they may be utilizing different systems. They also have a lot of them have are medically complex, and so I think that's also part of the challenge is trying to coordinate. Who sets up the appointment, who can give consent, how consent is given. Working with older adults who are also, who have dementia, I think that also is a little bit challenging. And then physically, it can also be challenging because we know individuals may have, some limitations with mobility. And so I would say those are the challenges. I also noticed that my older adults are also dealing with mental health issues, loneliness, depression, and that can be quite challenging as well, even though it almost seems like when I go to see them in their homes, it's, some of them look forward to it because they're going to get to talk to someone else. They haven't had family visit them.
Yes.
So those are some of the things that come to mind. It's a lot. It's a really big question.
Yeah, yeah, I totally understand. I used to work in a nursing home in a rural area in Missouri, and if I was even like a couple minutes late, they were like, "I've been waiting on you. Like I got dressed. I've been waiting for you to come." So
Yeah.
it's super. Our presence is super important, and they are dealing with a lot of unique challenges versus the general population. With that being said, what do you believe are the unique or specific oral health issues that are more prevalent in individuals in the aging community? And how do you think they differ from a general population?
So our aging adults, some of them are no longer able to, perform their own oral hygiene, or it's not as great as it used to be, whether that's because there's a, change in cognition, physical, disabilities, impairments. That's one challenge that can increase the risk for, dental caries, periodontal disease. I often see root caries is a big one. And I believe, that's definitely tied into polypharmacy. We know that the majority of adults have 1, 2, or more chronic health conditions. And so they may be on multiple medications. And so, that issue with xerostomia is highly prevalent. And so I do see a lot more caries, root caries especially. Individuals who wear dentures, sometimes you also see, fungal infections. And so I think really it's what I see in the mouth is that oral systemic connection. And it's devastating, Tiffany, to think that these are individuals who used to go to the dental office, every 6 months.
Yes.
Used to take care of their teeth, and now it's just it's gone.
Yeah, absolutely. I was kind of thinking about the question I just asked before, regarding the unique challenges. And one thing that I feel like I kind of specialize in is bringing technology into the picture to create access. So I want to kind of bridge here with my next question. Okay.
Sure.
Um, how have, in your opinion, technology advancements in non-traditional dental delivery models such as teledentistry, mobile units, there's so many things to name, AI, have played a role in improving access to oral health care for individuals in this demographic? And what do you believe the future holds for the merge of these two, the aging and technology?
Ooh, I am so hopeful. I maybe I'm being a little super optimistic here, but I think that the future is definitely going to incorporate more of our technology. So for me, I believe the use of portable dental equipment, the use of intraoral cameras, these are the types of things that have been able to allow me to bring care to my patients. So really meeting them where they are. We know that some
Yes.
individuals are just, it's not as easy for them to be able to go to the dental office. You bring up an excellent point about the importance of our community members who are in rural areas. So for me, technology has really helped me to be able to increase access to care. It's allowed me to also partner with my dentists that are in the area who are also working with this population. They're busy doing, the work, and I can send them photos. Portable x-ray equipment is also, I think, a really great piece of technology. I'm excited to see the AI and to see, I haven't dabbled that much into it, but I think that there's definitely a place in dentistry for it. And so for me, again, it's being able to meet my patients where they are.
Okay, you're talking about meeting your patients where they are. So, can you share with me some examples how you have met your patients where they are with the use of telehealth or technology, mobile units, and have overcome some of those unique barriers that we were talking about before? And what are the benefits that you have observed in using these approaches?
So, for example, I have patients who are no longer able to walk. I had a patient recently who she's in her late 90s. She was still going to the dental office, and from, 1 week to the next, she just wasn't able to walk anymore. And so for me, being able to come in, use my portable equipment, I was able to continue that care that her dentist had been providing. That whole team, they've been taking care of this patient for such a long time. It was important for her to continue her oral hygiene appointments, dental hygiene visits. And so again, that technology allowed me to be able to continue that. I've had patients who have gone years without having, an oral assessment because they just cannot leave the house. They don't have transportation. It's a hardship on the family to go to the dental office. You know, someone has to take time off of work or pay someone to go there. So these are, again, I would say some of the real positives. And really, it's just another avenue for us to, you know, bring care to patients who are literally sitting at home without any care.
And I just want to, too, you keep saying like meet patients where they are. Can you elaborate on that a little bit more? So,
Yes, absolutely, Tiffany. So when I say that, I also want to uplift my patients who have experienced trauma, who have severe dental anxiety, who, you know, are just going through a hard time or a tough season, and they're not able for, you know, a number of reasons to leave their home or to come into the office. So I think providing care to patients in their home, wherever they reside. I know I have other colleagues who have been able to leverage portable equipment and technology to also deliver care in school-based settings. So different population, but again, you're meeting patients, people where they're most comfortable. And so for a lot of them, that's in their own home.
and I think that's key. I mean, I think with demographic changing, as a industry, as a health, a means of healthcare, which I believe is a human right, um, we have to meet patients where they are. I think that's so important. And we're not going to see patients always walking into that traditional dental clinic. And so I think it's so important, and I highly believe that technology can kind of bridge that gap and make sure those patients aren't left behind.
Yes.
So I think that's a super important point. So I thank you for breaking that down.
Of course. I
Um,
would also add one other point to that, Tiffany, is for me, because you know, I am not working a traditional like 9 to 5 in the dental office. I'm able to also um, provide patients with appointments that are, you know, later in the day, in the
yeah,
evening. I have older adults who just the mornings aren't the best. And so I think that's also one of the ways that I'm able to meet them where they are is to provide care when they're at their best, and when it works for them. So really with having like a more person-centered approach to our delivery of dentistry.
absolutely. I feel the same way when I worked in nursing homes. There's times where I went there and maybe the hairdresser was there and,
Yes.
so I'm not, that's not a good time for that patient. Or, there's, like an entertainer there that they've been waiting for a month there. So, I mean,
Yes.
yeah, like really, making sure that it's patient-centered, even
Yes.
though, considering all the, kind of unique circumstances and barriers that you were talking about, because 'cause they're still human, they
Yes.
still, um, deserve autonomy of treatment and, consent to care and all the considerations that the general population would receive, even though care is coming to them. So, yes,
Right.
I love
Yeah,
it.
choice
Yes.
is important. I think sometimes in the dental traditional office, you know, and depending on your team, I mean, sometimes there's one slot open and that's what the patient has available. And sometimes they come in and they might be a little grumpy, and it's because they're missing, you know, some activity that you know they really look forward to. So yes, that's I love what I do. I love the population I work with, and I feel like it makes me slow down to really think about, you know, what does this mean for our future? our aging population just continues to increase, and I'm not sure if we're ready, so I think we've
Yeah.
got to start thinking ahead.
Yeah, and so I think that's really important. So some things that we talked about were unique challenges for this particular population. We talked about how those unique challenges differ for the general population, and incorporating some things to deliver care to this specific population. So my next question for you is um, how do you believe oral health care professionals can adapt their approach and techniques when dealing with patients in this demographic?
Hmm, great question. I
How do
think
we
first,
disrupt this dental model that you're talking about? Like,
I think about your parents, think about your grandparents, your neighbors. How do you want them to be cared for? I think if you really uh, think about the care that you would want to give your own family members, I mean, it's to me, it's a slam dunk. It's pretty easy. Patience, we really need a lot of patience when we're working with this population. I also think it's if we haven't had clinical training. So a lot of times we can take a course, we studied some of this in school, but when you don't have the opportunity to apply that didactic learning, it can be a little scary, right? If you haven't worked with the older population or people with developmental disabilities. And so I think it's not that different from treating the rest of the population that you see. I mean, the tools in your toolbox, things like, are everything that we have that's for prevention. When we think about children, I think we really focus on prevention with our children, but these are the same things can be applied for our older adults and our individuals with developmental disabilities. I think not being afraid of providing them all of their options. Sometimes when we think of our older adults, we also think, oh, they're on fixed incomes. They might not be able to afford those implants. And, that's not always the case. And again, we should be providing our older adults with all of the opportunities that we provide, just like our other patients.
so I really love that. For people who are really interested in working with this population, what advice would you give aspiring oral health professionals regarding care and advocacy?
Ooh, great question. I think I tend to say focus on your local community. So really reaching outside of dentistry to community-based organizations, particularly those organizations that are already working with older adults, people with developmental disabilities. I think that's a really important piece. For example, here, my home state of California, we have registered dental hygienists and alternative practice, right? So I'm able to deliver services in home. A lot of people don't know that this is available. A lot of people don't realize that, our older adults have teeth and that they still need care. There's still some of that misconception that, when you're older, your teeth are going to fall out. We're just going to use dentures. They don't need to be clean. So I think really is bridging our expertise as dental healthcare professionals to the community and to those other health professions or caregivers. I work a lot with our in-home nursing professionals. And so I think really is getting to know who's in your community, raising awareness. I think we have to acknowledge that a lot of what we know it's still not general knowledge for our public. So I think those are ways that we can raise awareness and really advocacy is to speak up and to share what we know with our community.
With that being, I'm going to ask you if you don't mind giving one point of clarification. So
Sure.
you said it in the state of California, you are a RDHAP. Can you explain what that is?
Yes, so it's called the Registered Dental Hygienist in Alternative Practice. And this is an additional licensure that you can have outside of just the RDH. So it was a little history on that. It started off as a pilot project years ago. I believe in 1998 is when it became official. And so we are able to provide portable dental hygiene services to people who are, and I do quote unquote, homebound. We can provide care in schools, in areas where there's health professional shortage areas. We can also set up a brick and mortar practice in those areas where there are no, dental health professionals. So we provide dental hygiene services, and we do have to have a partnership with a dentist. And about every 18 months, we have to have a prescription that is signed by the dentist or a medical provider, a medical doctor or a surgeon that says, yes, this person needs to continue to receive dental hygiene services. So that in a quick summary is what we have here in California.
Okay, thank you. I just so
Sure.
people understood what that was.
Of course.
Okay. So my next question is, what are resources that are available for oral health professionals who want to further educate themselves on providing care to patients with IDDs or aging patients?
Ooh, good question. There's a lot. I think there are associations that we can partner with for our older adults, as well as for those with developmental disabilities. So I think that we could really lean into these associations that specialize. There's also some dental programs where there might be like a year that you can study, gerontology. There are also training opportunities, CEs that are available. I would also say is lean into those who, are already working with this population. I think I wrote down a couple of things here. There's a geriatric fellowship that's available. There's also a program for nurse practitioners in oral health. So again, even though this is targeted towards our healthcare professionals, I think it also gives a really good overview for us that, for those of us that haven't worked with this older population. So those are some of the things that I think would help.
Okay.
Yeah.
Okay, so we talked about a lot of things about delivering care to this particular population, and we talked about a lot of clinical stuff, but I want to
Yes.
get to your other side, one of your many jobs, but you work as a health program specialist for the California Department of Developmental Service. So you work on the policy side as well, and so. I want to get into some questions about because we know there's things clinically that we can do to impact care, but we know that their policy is a big, and advocacy is a big part of what also impacts what we do in
Right.
clinically. So I want to get into some questions regarding that. What are well, first, can you share any specific experiences where you've seen policy changes positively impact access to oral health care for this
Sure.
population?
So I'm going to reference again my home state in California, specifically allowing hygienists to be able to, have this additional training and licensure. I think that was a huge policy change and a huge win for us to increase access to care. And this really, the way that it started, I think I mentioned earlier, it was from a pilot project that was really focused on providing care for those at our, so in California, we have what are called regional centers, and the Department of Developmental Services oversees these regional centers. And so there are services supports to people with developmental disabilities. And so I think that, you know, that was huge, because prior to the RDHAP here, you know, there really wasn't an opportunity for people to receive care in the community. For example, like at home or at school or at a day center. I believe also policy that allowed, you know, hygienists to be able to provide SDF, or even for dentists. I know that there are, you know, depending on where you're at in the country, things like that. We know that, you know, it's safe, it's effective, silver diamine fluoride, and there are some places where, you know, the evidence the policy hasn't caught up to the evidence that we know. So those things have been great. I mean, I would say also outside of the US, if I may, Japan has done some really great things for their older adults. They pay for dental care for their older adults, and they've had this campaign since the late 1980s that's called the 80-20. So they want to ensure that adults have 20 teeth that are functional by the age of 80, that they keep 20 teeth. And so I think those are the types of things where I see policy change really benefiting the older population. I'll pause right there, Tiffany.
No, I think those were great examples. Thank you.
You're welcome.
So what are some of the key messages or recommendations that you think we should convey to policymakers regarding oral health for this population?
So before I answer that, Tiffany, I just want to make sure that I'm not here representing my department that I work for, my state agency. So everything that I'm sharing are my personal thoughts surrounding this topic. I think it's important for us to consider the need for more surveillance of our older adults and people with developmental disabilities. We know that these populations, not only are they underserved, but they're also not researched very often. And that's for a lot of reasons. But I think just getting a good understanding of what the status is important, so that we can inform our decision making. So I think that's really prioritizing, you know, funding to try things out, or to implement programs that we know have been safe and effective in some of our other states.
So I have a question. Like, so you in your position, there's a dental professional there. So do you think it's important to have dental professionals in these type of positions, and even creating these type of positions? What is your thought on that?
Absolutely. So I will talk a little bit about my role within my department. We have a whole clinical services branch at our Department of Developmental Services here in California. And this has really been the first time that there's been a clinical presence. So I am one of the dental persons that were hired on 2021, I believe. And I also work with nurses, behavioral specialists. We have a psychiatrist consultant. And so I believe that it's important for our local and state, federal governments to have the expertise of the clinicians. You know, there's great value in having our researchers, our policymakers. Like, we really need the experts from all areas. But I do think that the clinical perspective is often missed, we don't include it. And so sometimes the policies that we develop, don't always align with what we know works or doesn't work clinically.
I think that's awesome. I I'm I feel very encouraged and with your role and your presence, and because I think it's super important. It reminds me of like one of my first jobs in public health was actually being integrated into a medical office. So
Yeah.
and I think it was such a difference maker for those patients, to have my expertise there. So I believe in that type of integration, especially on that level. On the clinical level and on that level as well is super important. So thank you for everything you do there. So
Of course, I just feel so fortunate to be able to be included because, again, uh, our dental professionals aren't always part of that like healthcare conversation. We're not always considered part of that healthcare team, and I have been able to really bring awareness to dental in my position, but also to leverage our the partnerships with that are already in the community where it might be something really, it might be really simple to really just kind of weave dental into a program that's already existing. So I also would say that sometimes when we look at our local state government, they don't always have positions that specifically are asking for dental professionals. And I just want to tell you all that our skill set that we have is transferable. And so even if it doesn't say dental, there are ways that we can transfer everything that we do chair side and outside into some of these roles. So I always say we belong in all spaces, and
yes,
it's been a
shoot your
privilege.
shot, right?
The worst
Go
thing
for
is
it.
no,
Yes.
but we've educated them on how much we know and the value that we bring. So we have to advocate for
Absolutely.
ourselves too.
Yes, absolutely. And that's how we also advocate for our patients as well. And
Absolutely.
yes, awesome. I love that. So, um, going on into the next question, how can
Sure.
we erase this and promote public support? Because public support is also an important piece to changing the delivery model for this particular population. Um, how can that support improve oral health care access um, for these individuals?
I'm gonna say again, uh, go back to your local community, right? Is connect with those that are in charge at the local level. Meet with your representatives. Write the letters, send the emails. If you can get yourself on the news, do it. I think really is just being engaged in our community. I really think it goes a long way. Educating people on what we know, what we have been, I feel like screaming at the top of our lungs about for such a long time, that the mouth is part of the body. And so I think that that's one way is to continue to do that type of work, and not be afraid to do it, and not be afraid to have doors shut in your face as well. I think our communities are made up of so many individuals, and you just never know who might have that aha moment and say, oh, I never thought about that. So I just say, talk to everyone and anyone who's willing to listen to you. And again, reach out interprofessionally to our other colleagues that we know are already working with our folks with developmental disabilities, our older adults.
I love this theme of community that you're talking, that you bring up pretty often. My husband's actually a therapist, and he teaches a course at the local community college because in behavioral health, they use a model called community health workers.
Yes.
So it's utilizing people within the community um, to bring help with services and identify issues. So
Yes.
how does community engagement occur in the dental community? How do we become engaged with our community, and how does that benefit the people around us?
You know, I think when we talk about community engagement, a huge part is for us to also be listeners and observe. And so, attending cultural events, we can also go to places of worship. I mean, I think really leverage those connections that you already have. We need champions. And so that idea of utilizing our community health workers, I mean, that's something that we're looking at here in California too, is how do we connect our oral health initiatives, and ask for their help in this area. So I think it's really having creating opportunities for us to get to know who's in our community, what are their needs, how do they want to receive their services, outside of dentistry. Are there other needs? Do they have food insecurities? Do they live in safe environments? I mean, really, it's a really it's complex, but I think it doesn't have to be. We can start really small. And so it's just being present in the community. We oftentimes are in our clinic, right? We're in our operatory all day. The weekend comes and we're trying to rest and recover. But I think is being more intentional about getting to know those in our community. So I hope that
I
answers that
agree.
question, Tiffany.
Yeah, I have a neighbor that I have a geriatric or aging couple that are my neighbors, and I know, like, when I'm talking to them, I'm looking at their teeth. I'm looking, and I'm also asking questions like, "How are you doing?" Um, you know, um, where do you go to church? Where do you work? Do you have a family member close or present? How are you getting here or there? So I think like
Yes.
just even small things like that, having conversations, which I'm a total introvert, so it's super hard for me. But I'm trying because I feel like that's important because I can possibly be a resource
Yes.
to that maybe they haven't seen a dentist in 20 years and I just don't know. So but they have a regular dentist and that's great. But just having that conversation rather than assuming, you know,
Right.
um, is it could open up a realm of possibilities.
Yes.
So more with some more advocacy stuff because
Sure.
that's my jam. I love it. What role can oral health professionals play in advocating for policy changes to improve access to dental care?
I think first and foremost, I think that we have to really um, we've got to partner like all of our team members, right? So we've got the dentist, we've got our hygienists, we've got our dental assistants. I think everyone who is working in dentistry has to really come together and decide and almost strategically plan on what's most important. And I think that when as a collective, when we are able to come together and really take a stance on increasing policies that are going to help our communities improve access to care, improve oral health. I mean, I think that that's a big one. Unfortunately, sometimes we see that within our dental community, we sometimes don't have alignment between like our dental assisting, our dental hygienist, our dentist. This sometimes happens. And so I think that really building that partnership is really key. And then we go to our state legislators and that we start providing testimony, that we really share what we know is true, what we know, what we see every day, and what we don't see, right? The number of individuals who are not accessing services, even those who have maybe state Medicaid, we know that the utilization isn't always what we want it to be. So I think it also leveraging the data that's available to tell the story.
So I love this because I feel like before, like when I first started off, as a clinical hygienist, I just didn't know where to start. I
Yes.
saw issues, I saw things that bothered me, but I'm just a clinical hygienist. I'm working 8 to 5. I have a little bit of time, but I care. I care about
Mhm.
what I'm seeing. I'm caring about what's going on. How do I start? How do I start to advocate?
So I always want to say start with your local associations, whether that's your dental association, your hygiene association, assisting association. I think it's important to raise those issues there because we know that there is some advocacy work that's being done. Now, we also know that these associations are sometimes run by volunteers who are overworked and not always paid, right? So that can be a challenge, but I think that's one avenue. I think, again, getting to know your local representatives in the area, going to like city hall meetings, any opportunities where you can be that voice and that representative for the community members on the dental side. I think that that's also a place. And like I said, sending those emails, sending those letters, it might not feel like it's going to make a difference, but you have to remember that our government works for us. And so they do have to, read those emails. Visiting is also, just having a conversation with your local, representatives and say, hey, did you know that, and use the data that you have. We know that we don't track everything, but use what's available to you. We just had the Oral Health in America report that was just published after like 20 years. I think use what we have. This stuff sits, it's published and it sits, and we know about it and we try to use it, but we need those outside of dentistry to hear these numbers and to hear the stories. I think we can also ask our community members, our patients, to help us join in these advocacy efforts for them to also provide testimony and share their stories.
Awesome. I love that answer. Because sometimes you just don't know where to really start. And you can look at people that you see on Facebook or, and just feel like, I can't do that, but what can I do? And so I think you really made some great recommendations on how to use your voice, how to get the public to use their voice. And I love that. So, what are, in your opinion, some current policy challenges and barriers that hinder access to oral health care for, um, for this population?
I would say one major one that's been recently a real hot topic is teledentistry. So when our states don't have policy that allows us to be able to utilize teledentistry, or when we don't have reimbursement in our state Medicaid system for teledentistry, that these are two big ones that we states might have to look at. I think also allowing policy that's going to look at these more innovative ways of delivering care, such as utilizing our existing workforce, like our dental hygienist. And again, every state is very different. We know that there are some that have really great partnerships between the hygienist and the dentist and the assistant. There's this whole team approach. So I think also allowing the leveraging the workforce that you have to utilize, you know, all of their abilities, because I think sometimes we're underutilized. And I'm speaking from, you know, at my role as a dental hygienist. I know that the dentists that I work with are happy not to have to come out and, you know, take an x-ray or a picture if I can do that for them. So I think we need to have policies in place for that. I would also add that when we look at our nursing homes, our long-term care facilities, I would love to see a little more efforts that are going to allow us to be able to conduct assessments, like yearly assessments. You know, people may or may not want to receive, you know, dental care. Everyone has a choice, but I think that considering how expensive it is when we have individuals that end up with, you know, pneumonia, aspiration, and we know it's tied to, you know, disease in the mouth. I mean, this stuff is costly. And so I think that we could probably do a little bit more in some of these licensed homes. Maybe work with our caregivers and our you know, nursing teams to really prioritize oral health. And again, that's not their area of expertise, but if, you know, if they maybe are unable to do it, they've got a huge workload, to allow us to come in and be that partner when it comes to oral health. So probably gave a lot there, Tiffany.
No, I like it. What I would like to talk to you a little bit more, I think you hit on it a little bit, it's some of the financial policy barriers. Can you talk about that a little bit more?
Yes, I mean, with our older adults, you know, some of them are on fixed incomes. You know, some states have benefits through their Medicaid for older adults. We need a Medicare benefit for oral health. I think these are also, you know, areas that we need to look at. And I think when it comes to providing care, you know, we have cost-effective measures that can improve or prevent disease. And so, you know, perhaps if we're not quite ready to have a blanket policy that's going to provide dental care for all, perhaps we can start off with some you know, demonstration projects or some programs to really kind of get an idea of the effectiveness and sustainability. So I think we have to prioritize really. We have to put the money where it needs to be, and that's in providing care to our older adults and people with developmental disabilities. It's costly. I think it's more costly when we don't. And they deserve oral health. All of us do.
Yes, I love that. I know there's been I work in a mostly geriatric, well, it's just an aging practice where most of our patients are 50 and above, and you know, they're transitioning to Medicare, which they find it very difficult from retiring to transition, and they feel like they paid into something their whole life and it doesn't really cover their needs, and that's very difficult for them. So I know that's what I've seen specifically in private practice, that's a huge barrier, the financial barrier. I mean, you're using your life savings to pay for dental care, replacing teeth with bridges and implants and things like that. And that's if you can even afford that. So yeah, so that was excellent. That was super good. Thank you.
Thanks, Tiffany,
so much.
Course.
Yes. So do you have, I'm gonna kind of wrap up and just ask for some general thoughts, comments, advice for us, for this particular population, about technology, about anything. Give us some good tidbits.
I think, I think we have to remember everything that we have available to us. Our technology for our older adults is really, I think, pivotal in increasing access to care in a way that is, again, going to meet our community members where they are. I think just being open-minded to these alternative or, settings or delivery models, I think is really key. And I understand it can be a little scary because it's changed, right? We've had this traditional model of care where people go to the office. But I think for me, I see the value of the work that I do. My patients, would go without care if I wasn't able to bring them portable services where they are. And I think it's when we think about our workforce, we're still having some workforce challenges nationally where we're still recovering from the most recent pandemic. And so I think it's also important to consider that some of our colleagues might prefer this route, and if they're interested, to really find ways to allow that to happen. I think our older adults and our individuals with developmental disabilities have been ignored for a really long time, and there's gonna be a point where I think it's now, we can't ignore it anymore. And I would say, think about your grandparents, think about your parents and your neighbors, and do you want them sitting there? And I literally say, with teeth that are rotting in their mouth, in their head. We know that the cost of medical care is so expensive. We are one of the countries that spends the most money on healthcare, and we are, we're not the healthiest. So I think it's time to look at our systems and, be more innovative and use everything that's available to us.
And I actually have one more question. I'm sorry.
Sure.
So I know when we talked about kind of like the theme of collaboration. I mean, basically, a
Yes.
lot of what you actually talk about is medical integration, and I feel like that's
Yes.
kind of like your specialty. You have a Facebook page dedicated to it. A
I
Facebook
have a
group.
research, a
Yeah.
Facebook group that's focused on research. And so this area of medical dental integration, I mean, I think that for our older adults, our people with developmental disabilities, a lot of them have, medically complex challenges. And so we won't be able to do this by ourselves alone in dentistry.
And even I just wanted to us working as dental professionals together too. I think that's another common thing that we discussed, and how important
Yes.
it is for us to work together, right? So
Yes.
even the model in California, it's not it's a collaborative situation.
Absolutely. Yes.
Yes.
I love working with my mobile dentist. He's got a great team. He utilizes his dental assistants. He also hires hygienists. And so it's been really great. If I'm not able to see a patient, because I just don't have the time, the capacity, I know that I can rely on my partnership with a dentist that I work with. and he can see my patient, and really it's not my patient, it's shared. You know, we share our patients. We're providing care. It's the entire team. There are times he sends his dental assistants if, you know, there's an x-ray that needs to be taken. And so yeah, I wouldn't be able to do the work that I do without my dentist and his team. So collaboration is where it's at.
Yes, collaboration, integration, innovation. And so,
Yes.
yes, so I would like to end it on that and open it up for questions. Thank you so, so much
Of
for being here
course.
with us
Thank
today.
you. Thank you, Tiffany. I see there's a question in the chat box.
Would you like me to read it for you?
Yes, please, Gary.
I believe she covered my concern about perhaps aiding the faculty or facility staff on oral health care. I do mobile dental for 4 years in memory care and assisted living facilities. The staff were totally clueless on even how to brush the teeth of the people under their care. As with most situations in life, if a certain area of our health is not important to us, then we are not able to pass that concern on to others. How would Ms. Diaz suggest we approach this? I always offered my time.
This is a great question, and I can relate with these concerns. You know, there are training modules, there's training that's available, but I think we've got to find ways to incentivize, possibly even require. So again, it's difficult because I believe the home health, well, not the home health, yeah, both. I would say people that are the staff that are working in these facilities are oftentimes overworked, underpaid. And so there's really no incentive to add on this duty of oral care. I know that the one of the dentists I work with, he will sometimes, I think a lot of the times he ends up prescribing toothpaste that's like a high fluoridated toothpaste. And he says that when you prescribe, then they have to administer, kind of like they administer meds. That's one approach, but that still doesn't guarantee that there's going to be a great technique when it comes to oral health. I honestly feel like this has to be a policy change.
1 gig
Wow, that's fast.
with 99.9% network reliability.
Oh, I'm hearing something.
Sorry about that. I
worries.
believe the Missouri Division of Developmental Disabilities has instructional video available online. I'll see if I can find it and drop it out here for people to see.
I will, I'd like to recommend, there is one program that was developed by the University of North Carolina at Chapel Hill called Mouth Care Without a Battle. It's a couple of years old, but I think that's a good one. The University of the Pacific also has one called Overcoming Obstacles. That's for caregivers. Mouth Care Matters, which is in the UK. They've got some great resources. I think we've got to find ways to incentivize. And again, if it comes down that, you know, this is just not feasible, then maybe allow our dental assistants, our dental hygienists to be part of those care teams, to be able to come in and do the work and of course be reimbursed for it as well.
I have found the
You have
link, so I'm going to pop it in there if you'll give me a couple of seconds. So I can get it in chat for people to find. It's very short, and I believe it is aimed at kind of the frontline staff. It should be out there. Let's see, Dr. Burnett. Hi, Dr. Burnett. She's making a comment that she feels very bad about seeing these situations at the over 60 facilities where she provided treatment, and she knows the staff are overworked. But she also saw things that she had to come back to do operative care. So I don't know if you have a
It's,
response to that, or
I understand it. It's frustrating. It's heartbreaking. I think that others need to see what we are seeing and observing and know to be true. And I don't think that people quite understand it. So I don't know, maybe we could have some like a campaign or something that really is showing the public what is going on. Because I don't think that our decision makers know, they don't see what we see. And so it might take some really intentional efforts to bring awareness to this. And again, I think there needs to be some type of a policy change in place that includes dental.
I will just make a few comments. In Missouri, we do have teledentistry. We're engaged in a demonstration project that's funded through the DD Planning Council. And Enable Dental, mobile dental provider, is working with us on this. We're really using teledentistry to increase access to care for people with intellectual and developmental disabilities. And then the Department of Health and Senior Services Office of Dental Health is engaged in a demonstration project utilizing teledentistry in nursing homes. So both of these things offer some promise. And I will add to that, with the DD Council funded project, we also are testing some measures to set up a circumstance in which there could be some incentive payment or an alternative payment model for these underserved populations. We think the state is interested in this. If we could kind of do some proof with it, we hope to get funding for a second year with that. So there are some things going on related to that we feel hopeful about. All of this stuff goes much slower than one likes to, but
I understand. I am thrilled. I'm so happy that these initiatives are undergoing right now in your state of Missouri. I think it is important for us to test some of these things out. And again, for me, when I say use the data that we have available, we know that we don't always have data to demonstrate the need in these vulnerable populations. And so I think that's a great way. Anytime that we can show that what we're doing is working, it's cost effective, it's increasing health equity. I mean, these are all things that are we need someone to show us the proof, right? And so these are excellent efforts. I'm really happy to hear that.
Well, stay tuned, and we may get somewhere with it. So there is another comment from Anne Premont. I am a geriatric fellow RDH, and I find many medical people do not think of the mouth as part of the body or health, and think of DDs as mouth mechanics, and educating them as part of systems. I taught in a high care VA head and neck cancer and our transplant patients.
Yes, thank you, Anne. Thank you for the work that you've done. Yeah, I think this goes along with those partnerships and collaborating outside of dentistry. I know I saw something recently in Montana. There's a program, Smiles Across Montana, and they bring dental care to the community. They have a lot of rural populations, and they have partnered with their nursing students at one of their universities, teaching them how to use, an intraoral camera. And so I think that these thankfully, when we see that there are some baby steps in the right direction, I think, you know, we might be able to do a little more, again, education awareness and interprofessional collaboration. I think, you know, it is slow, it takes time, but we cannot give up. And so thank you for the work that you're doing. And I appreciate the invitation to share a little bit of, you know, what's being done over on this side of the country.
Sure. You know, I will say there's a wonderful book written by Mary Otto a couple of years
Yes.
back called Teeth that goes into
Yes.
some of the history of the kind of schism. And, you know, if you haven't read it, it's a good read. I highly recommend it. And because it's written by a journalist, it's a pretty quick read too. So, but
Yes. And I think with that, Gary, the power of storytelling, the changes that have come about, unfortunately, you know, it took a death of a young child to make changes happen. But yeah, we've got to reach out. We've got to leave our op and continue to do the work.
Other questions or comments? Any inappropriate comments?
I'm ready
No.
for those. Just kidding.
Well,
Thank you.
maybe they'll direct them at me. No. Well, I think we're running out of comments. Do you have any or questions? Do you have any additional final words that you'd like to add? Either one of you. Tiffany might have a few things to say too at this point.
No, I'm grateful for everyone coming and thank you for this opportunity to share this information with the Missouri Coalition of Oral Health. All the great work you guys do is amazing, and even giving us this kind of sounding board to kind of discuss some different things that are happening to address issues within this population. This is my third um, kind of presentation or webinar I put together for Gary, and I feel like I just learned so much dealing with everyone, and hopefully everyone is learning some different ways and think it's kind of changing your thinking about what we can do to address the issue, not just from a clinical level, but from a policy level, and learning what's working for others and how we can maybe use some of those things to make it work for us. So I I really appreciate the opportunity, Gary. Thank you so much, Jeanette.
You're
And
welcome. It was my pleasure.
yeah, I'm happy to be here and be in this space and also work to help this community. So
Thank you.
Let's see. One other comment. I agree with Anne. The mouth is the window to the patient's overall health.
Yes.
That is probably a pretty good place to land. So thank you all. Thank you to Tiffany and Jeanette, and thank you all for being here and taking part in this. I did put a link for a survey related to this webinar. If you take a few minutes to fill it out, we would appreciate it. And I believe we have a process for getting CEs to you. For those of you who have attended, that should come to you fairly quickly. Just remember, we are a small nonprofit. There's not that many of us, so there's not a huge echelon of business office people taking care of these kinds of things, but we will get those to you. So thank you very much. We'll call it quits for the afternoon then, and talk to you all soon. You are free to leave the Zoom.
Thank you all for being here. Gary, Ashley, Tiffany. It was great. We'll connect soon.
Thank
Yeah,
you.
thank you so much for being
Of
here. Really, it was a
course.
good style, Tiffany.
Thank
Good.
you, Gary. I was kind of curious what you thought about it because